What's up, everybody? Welcome back to the show. Was that an awkward pause, Mandy? I wanted to jump in there like real quick, like super aggressive today, since we've been told lies our entire podcasting life of like, hey, give it 3-second pause and we'll edit it, and that's a lie.
It's just like this awkward silence of where's Josh?
Yeah. Maybe I'll keep doing that. Maybe the suspense.
Yeah. The suspense is way.
Maybe 8 seconds next time.
Like a bull rider.
Yeah. I kind of, You never know where I'm at. You know.
Oh, wow. Here we go.
When or where we're going to show up on this show. So, oh my gosh, it feels like it took a lot to get here today.
It's been quite the day. It's been quite. Do you know that this is episode 31? 31.
Come on.
3 and a 1. Mm-hmm.
That's what I'm talking about.
31.
Here we are.
I know, right? Like
veterans. That's what we are.
I'm an OG.
we got a podcast. What can we say? You know?
We can let it. Yeah,
that's crazy though. 31. So so we've been doing it for over a year.
Yeah.
Clearly since 2 months.
We've been just over a year. Yeah. It's exciting.
It is exciting.
That's exciting. I can't believe you stuck with me that long.
To all my 3 followers out there, thank you.
Thank you.
My wife, Rob, we know you're listening.
The kids, our spouses. Yeah. It's great.
Yeah, my kids don't listen. There's no way. My kids are like, Dad, you're lame. Yeah. They're definitely not. But no, what a day. It's been, going from one thing to the next. Yeah. And then today this is a cool episode, I think.
Pun intended.
That is, not intended, but it is,
indirectly.
Cold plunging and sauna. So it's definitely not as, I will say that I'm not the expert or it's not my passion when it comes to cold plunging and sauna as compared to hormones. But I know a little bit about it and can at least,
You've plunged yourself.
Speak on it.
Yeah.
I have. Yeah. I have. Not my favorite thing to do. I'm not going to lie there either.
Listen, I'm going to say this one. I'm going to tell you about that. There were things that froze on me that I didn't anticipate.
This is a kid's show, by the way.
So long. and you should have gave that disclaimer. Yeah. That took so long to thaw out. Yeah. I was like,
it's crazy.
I was only in there for 30 seconds. Why is it taking an hour for certain things
to come back to life? Yeah. No, it's legit. Yeah. I saw, we've got some patients who use that stuff religiously, which I love. And one of them the other day, he was walking out of the hall and he went to give me a fist bump and his hand was so cold. He's like, dude, I just got out of this thing. It's crazy. But the benefits are staggering for sure. It's just getting to that point where you can tolerate it and acclimate and be consistent. And, I'm excited to talk about it.
A big thing, consistency. So we get a lot of questions about it. So I'm going to fire away at you once you get started.
Well, I think we're going to talk about cold and heat therapy. So the biggest thing I'll say, just to kind of, give maybe a 10,000 foot view, cold therapy, there's a lot of different ways people do it. You can do it from, going outside when it's in the middle of winter. You can do it from standing in a cold chamber. You could do it from getting under your shower and turning the water cold. And then what we do at our office in particular is we do cold plunging or cold immersion. One of the main reasons we actually do that is because if you take all of those that I just mentioned and say, which one is the best? Cold immersion is actually the best. And when I say cold immersion, I'll define that. That means you are sticking your body, hands, which this is tough, but hands all the way up to your neck into that water, right? You got it all in there. And even, some people would say at least at the end, you're dipping that head down underwater.
No.
And so that is, kind of what cold therapy is. And we'll go into kind of the details of benefits and all that. And then you've got sauna therapy. And this is, we use infrared sauna at one of our locations. I've actually toyed around with more of a traditional sauna. We have infrared at both, actually, but we need an upgrade on one. And I've actually toyed around with the idea of should we do a traditional sauna? Because there's great evidence for traditional saunas when it comes to mortality rates and cardiovascular health and brain health. And there's not a ton of data, and it doesn't mean that infrared's not as good. It just means we just don't have as much. And so I think it'd be kind of cool to have traditional sauna versus an infrared sauna so that people have options.
Would it be fair to say that the reason we don't have that data is because it's kind of a new technology?
It's a little newer technology. And yes, and most of the data that we utilize for like traditional sauna is coming out of countries where they have used traditional saunas for decades, right? Finland, Russia. I mean, I think the large majority of Finnish people actually have a traditional sauna in their home. They're doing it
like it's what counts like half bath.
If you lived in, the frozen tundra, you'd probably have a sauna in your house too,
right?
And so I think they have so much data, and it's been such a pillar of their health for years in their communities that it's hard to refute a lot of the data that comes out of there. And it's big population studies, and so they just have a, here in the States where we may be using infrared maybe a little bit more, we don't have that. People aren't using it every day. People don't have it in their homes, so it's harder for us to really probably get the same level of studies that would compare to those Finnish studies.
Sure, so, absolutely. So which one are we going to attack first?
It's up to you.
Let's do, since we started with cold plunge, let's just plunge into the cold.
There we go. Come on.
Let's just plunge cold. Let's do it.
Okay.
So,
what you want to know?
Okay, so I have a lot of patients that come into the clinic that are going to go into the cold plunge. They want to do it. They've heard, all of the benefits of doing the cold immersion and things like that, but they want to know, okay, is there a time of day that I should be doing this? So let's just start there.
Yeah.
Is there a time of day that is a more optimal time to be doing it?
I would say yes. Morning time is going to be your ideal for some of the purposes of the alertness and mental focus.
Yeah.
One of the things that cold immersion or cold exposure does is that it releases catecholamines or neurotransmitters. So these chemicals in our body, like dopamine, epinephrine, noradrenaline, norepinephrine, which are excitatory, kind of your fight or flight, focus, alarm, hey, I need to get things done. I need to concentrate. So it's not that it would be bad necessarily to utilize it if your only time of day was 4 o'clock in the evening, but then you got to worry a little bit of like, is that going to create a little bit of a stimulation that makes it harder for me to sleep? So ideally morning time, because of those neurotransmitters, those catecholamine elevations. And then you also get a large majority of that release of those catecholamines actually stays elevated for several hours. So you can really, a lot of people like it because they're productive, right? And you tend to be more productive in the mornings when I'm right out of the chute and I'm getting stuff done. So morning time's better, in my opinion.
Okay. So then if you are going to bite the bullet, you're getting into this cold water, you're going to do it. So if you're going to do it, you might as well do it. So is there an amount of time to stay in? And is there an amount of time over a period of time that is optimal?
Yeah. 3 to 5 minutes would be a goal for people.
Stay in at a single time.
To stay in at a single time. 3 to 5 minutes would be kind of your ideal number. It's not... typically a lot of people have to build up to that.
Yeah.
And you've got factors, right? You've got... Some people are really sensitive to cold. So just their own variability within their body. Then you've got temperature of the water, right? So not all cold is the same. So if, our cold plunge is at 48 degrees versus somebody's who's at 51, well, I may be able to stay in there a little longer at 51 than 48. So, and it's really, they define cold water immersion of anything less than 59 degrees. So if you have your own, a lot of people will actually start with a little bit warmer water, right?
Yeah.
And it allows them to kind of acclimate. But if you don't, so let's say you're using a facility and that facility kind of has to keep it at a, fairly mediocre number where it's like, okay, 48, so I can appeal to all my clients. Then your time is probably your variable, right? So if I'm starting out in a cold plunge that's listed at 48 degrees, well, maybe I'm staying in there for 30 seconds. And then I'm going to do 60 seconds, and I'm going to keep pushing myself until I can get into that window somewhere between 3 to 5 minutes.
Okay. Is there too much? Can you stay in there too long? Yeah.
You don't want to stay in there much longer than that. I mean, you're going to start, it's going to start working against us. I mean, even hypothermia, you know what I mean?
Yeah.
Like 5 minutes is really, I've had a patient come out one time and she's like, I was in there for 20 minutes. I'm like, time out. Nope. We don't do that.
No.
Yeah. Let's educate.
Yeah.
So you do want to be kind of careful, because it is such a strong vasoconstrictor, especially with appendages and extremities and things like that. You want to be kind of careful.
So just in case for someone who doesn't understand what vasoconstricting is, what is that exactly?
Thank you for bringing that down.
I got you.
It is where your blood vessels would get smaller.
Okay.
So blood flow. So when you've got vasodilation, that'd be the opposite. That means blood flow is getting to an area easier because that vessel is larger. The flow is easier to get through.
Okay.
When you're exposed to cold, as an example, those vessels, right, are going to get constricted because your blood is going to go back into kind of the central part of your body because it doesn't want to be in your fingertips. So that's a vasoconstriction. So there's not going to be as much blood flow to the fingertips, as an example, in cold water. That's why your fingers get cold first.
Is it pulling from your extremities to keep your organs warm?
Correct. One of the things...
Look at me. Yeah. I'm impressed by that. Sorry.
You actually get a little bit of a filtration, or some people call it like a detoxification, almost like a cleansing, right?
Oh.
If I've got more blood flow directed to that central core during that 3 to 5 minutes, that can be beneficial to your liver. So like detoxification of your liver, because you've got more circulating blood flow hitting that liver compared to where it usually is kind of distributed a little bit more widespread.
Interesting.
Yeah.
So back to just timing, and one little caveat into that is, can you do this every single day for the rest of your life, or should you take breaks? Should you do it like 3 days a week or 5 days a week? Like, what does that look like?
Usually, and this applies to both sauna and cold plunging, frequency matters on most of the data, meaning daily is probably, when I say daily, I'd say 5 to 7 days a week is usually going to give you the greatest return on whatever factors you're looking at, whether it's mitochondrial health or, depression improvement or cardiovascular health. Most of the data is going to suggest that, hey, when you move from twice a week to 4 times a week to 6 times a week, there's I think dose response. There's a higher return on investment than number of frequent, the more you increase that.
Okay. So back to, you were saying that the temperature can vary, and it starts at 59 degrees is considered
correct
cold plunging. So if you are going somewhere to get it done, or if you're at home to get it done, if you're at home doing it and you're doing it in your shower, how do you know? How do you know what temperature you're at? And a shower is not anywhere near,
not as good.
Yeah,
but now you
do better to do it in your bathtub, right?
You would, yeah, because that would be immersion. But but then you'd have to probably put some ice or something like that.
Is that dangerous?
No, as long as it's getting cold.
So literally, I've seen where, and again, this is what you get sometimes when you look on social media, you get rando stuff. But literally, I've seen where like people get in there and like they've got these giant ice chunks in there.
That's just for TikTok famous people.
It could be. But then they're getting out and they're like, "Oh, the ice cut me," and I'm like, "What are you doing?" Like,
well, maybe, I guess, yeah.
I'm thinking to myself, go get the bag ice like you would put in your cooler.
Blunt objects.
Yeah, I mean, but anyway, anywho.
No, but I mean, I think you can get some of the perceived benefit from standing in the shower, right?
Yeah.
That stress response, it's like a shock response. Maybe
starting it, like starting yourself into.
I mean, if you've ever done it, I mean, it's, you're alert pretty quickly when you do a cold shower.
Yeah.
And so you get that again, catecholamine response in that, maybe just not to the same degree as you would, and you definitely don't get that benefit like central core, detoxification from a shower. So
I have a question about going from cold to sauna. So like, should you cold plunge and go get in the sauna, or sauna to cold plunge? Are using those two back to back of benefit at all, or is it counterbalancing it?
No, there's some good protocols and studies showing that sometimes it's actually easier, especially for that shock response, if you actually start in a sauna and go to the cold plunge. So it's almost like think of it from a workout, because that's really kind of what sauna does. Saunas mimic a moderate activity cardiovascular workout. So if I'm running for 45 minutes, I'm much more likely to want cold exposure than if
you want to drink cold water or whatever.
Right.
Yeah.
I want a cold ice pack or, cold rag on my head or whatever. So that tolerance, that adaptability of that experience is easier for patients who struggle just getting directly into a cold plunge. So it's fine. I'm not a huge fan of going back, go from
the cold
sauna, cold plunge back into the sauna.
Okay.
I would encourage that at that point. So do the sauna, do the cold plunge, and then let that natural thawing process occur.
Okay. So why?
Because you're going to miss out on benefits if you don't allow the natural process. So it's almost like if you're trying to microwave it versus like letting it, cook on the stovetop.
Sure.
That you're going to lose a lot of your cardiovascular benefits. You're going to lose because you've really kind of short-circuited the whole process of allowing your body's core temperature to return back slowly.
So cold plunge, and sauna may do it too, but I know that cold plunge goes after your brown fat, correct?
Correct.
So explain to me, although I have an idea of what brown fat is and how it does that.
Well, brown fat is visceral, deeper fat. You've got brown fat, white fat. White fat's probably worse.
These things.
In that,
where are they?
Brown fat means it's kind of deep, right? So it's going to be a deeper fat, and that it does tend to affect, cold plunging does tend to affect that, whereas sauna actually tends to hit white fat.
Okay.
So it's kind of interesting, more so than it does brown fat.
Is white fat in front of brown fat? Like if you're going through your skin? White
fat would be more superficial, closer to your skin. But brown fat being kind of that deeper fat is hard to penetrate. So we call it lipodystrophy, where you're really trying to break down that fatty tissue, and cold plunging can accelerate that process.
Okay.
Yeah.
So you want to? I picture it like this is just my mind at work, and it's not always what people understand, but I picture when you get out, you're convulsing, like you're shaking. When you get out of that cold plunge, like you can't help it. You can't stop it. No one can love it out of you. You are shaking.
It's pretty intense.
So I just picture that in my brain and how it works. I'm thinking I am shaking the mess out of that brown fat for it to just me to get rid of it later.
It's like a vibration. It's like I'm just vibrating.
I'm just vibrating my brown fat out. No big deal.
No, I think it, and I don't know that I fully understand the physiology of that, but I think the process through which you've got vasoconstriction, it's you're activating your body's use of that brown fat. You've got lowering of it's probably a plethora of that controlled stress response that allows us to target that brown fat, as opposed to being like, I'm just shaking and vibrating this brown fat off of me.
Look, I need to see it, feel it. But one more question about cold plunge, and then we can switch if you'd like, unless you're just saying, hey, you didn't ask all the right thing, girl. But one more thing is, okay, if you are a bodybuilder or heavy lifter or someone who works out pretty intensely with heavy weights, is the timing of that in terms of workouts, does that matter?
Yes.
Okay, so tell me about that.
It matters with hypertrophy purposes.
Okay.
Right? So it wouldn't matter if I'm doing cardiovascular health.
Okay.
So if I'm running or, riding my bike, you could, jump into cold plunge pretty quickly.
Okay.
If you're doing resistance training for the purpose of hypertrophy of that muscle, hypertrophy meaning trying to grow the muscle. So you're, the way resistance training works in layman's terms is you're micro tearing. You're tearing the muscle down in small areas. One of the reasons people call it the pump, right? So, you feel kind of swole after you do biceps, as an example. Yeah. Well, one of the reasons that happens is because you're sitting there working that muscle over and over and over, and you get blood flow because of vasodilation and breakdown of that muscle. Well, that's beneficial. You want that process to grow for the hypertrophy of that muscle, so you need that blood flow in that muscle. You need that muscle to kind of repair and then recover, and then you do it again.
Yeah.
Well, it's kind of like, should I get out of the cold plunge and jump back in the sauna quicker? If I'm expediting a process through which my body uses to recover, so for example, that hypertrophy, if I jump into a cold plunge and constrict my blood vessels, right? So now I'm not getting as much blood flow to my muscle, then my benefit of that workout is going to be limited.
Okay.
So you want to, if you do the cold plunge before a workout, you actually want to do it well before the workout and be thawed out, so to speak. So you probably need about an hour of like cold plunge, thaw out, exercise, get your metabolism getting back up, thermal, make sure, thermally that you're kind of back to close to normal, then you can work out. If you work out first and then do it, it needs to be a significant time, and ideally I'd say probably the next day or beforehand. But if you did several hours afterwards, you're probably okay. But if I'm doing it for the purpose of bodybuilding, I'm probably doing it the next day. I'm probably not doing it, or I'm going to do it before the workout, but I'm probably not doing it that day.
I would say that also, not just for bodybuilding, but also for anybody who's trying to gain muscle. Yeah. That is. Yeah.
If the purpose is really like I'm doing this workout to be fitter, stronger, bigger, then yes, you would probably want to limit the timing of the cold plunge. If you're just trying to be health conscious and your workouts are, pretty, standardized, and that's not you're maintaining, you probably have a little bit more freedom to say, all right, 4 hours after I work out, I'm going to go to the cold plunge.
Okay. Yeah. So what about the sauna? Same question. Sauna, is that?
It's great.
So there's no timing on that necessarily.
What's the name of the? There's a gym, the Hot Studio or hot yoga, Hot Box.
Oh,
you've got all those things. I mean, part of that's they're working on
or
the
tobes where they don't have any air.
Yeah. So you're vasodilating to the nth degree, right? So it is to your benefit to use a sauna before or after.
Yeah. Okay. So that one, timing isn't. Is sauna more of a recovery piece in terms of where cold plunge is like, let's wake you up, let's get you going, let's be alert? Is sauna and the infrared trying to bring you down and relax you and calm you, and is it for rest? Is it more along those lines?
Well, if you compare it to, like, if you're measuring metabolic rates, so let's talk blood pressure, heart rate, things like that, it's going to be similar to a moderate cardiovascular activity. That's not rest.
No, that's not rest.
Which is why it's got benefits cardiovascularly when you look at some of the data. So, but now it can have benefits mentally because you aren't running.
Yeah.
But running can be beneficial. When I used to run, I probably was in one of the better mental states because I didn't listen to music. I didn't listen to podcasts.
You just ran.
I just ran for 20 minutes, and I just sit there and think through stuff. And you can kind of have that mental capacity in a sauna where I was listening to something this week. One of the benefits of the sauna is it's really hard to take a phone into a sauna because it's going to stop working because it's going to get hot.
It's going to get too hot.
So it's almost like it's separating us a little bit from electronics, right? From the digital world for us. Some people, Rhonda Patrick, who's pretty well known, she's a PhD scholar and really kind of focused on saunas. She talks about she'll actually take papers and read papers because she's super dialed in with her saunas. So it alerts her. So she feels like she's more dialed in, and so she may take a paper or she may make some notes or she's going to use that time almost as a workspace. So everybody's a little different, but I wouldn't
take
think
your computer in there.
It'd be hard to
burn it up.
Yeah, it's gonna sting on your lap, sitting there on your thighs. But it is, and one thing that we didn't talk about with cold plunge, and I'll bring in even with sauna. One of the things that we really look at from a health standpoint is called cellular health or metabolic health, and both of these have similar benefits. And I always talk about it. It's kind of like the exposure to extremes, right? Exposure to extreme cold, exposure to extreme warmth can be beneficial for the aging patient to combat failure of our cells to understand how to implode and recreate.
Okay.
So we have mitochondria. Let's think of if you've got your little cell in your body. Mitochondria is what we call the powerhouse of the cell. It's what helps that cell function. As we age, those cells become less and less responsive and they become low functioning, and then they kind of just hang around, right? And so they're becoming more dormant and not efficient. And when you expose yourself to hot that's extreme or too cold that's extreme, it becomes a little bit of a survival of the fittest where you get rid of unhealthy cellular health, right? So you start to break down that mitochondria. My body then starts to have to replenish it. So now you're starting it's causing that factory to continue to produce, which is beneficial metabolically, longevity, quality of life, those kind of things.
Okay. So what is the difference between the sauna that you go in and you pour the water on the rocks and the steam comes out? And
don't do that at Crunch Fitness, by the way. It'll shut it down for a month.
Is that what happened?
The rocks are just for looks.
Oops. My bad. There should have been some kind of a warning label.
Probably was, but why put rocks in there if you can't pour water? Because everybody immediately thinks like, oh, just add a little water.
I've legit seen it on every TV show or movie or whatever. I mean, you got to put a white towel on and you got to pour the water on the rocks. I mean, that's what you do.
That's right. So anyway,
without any
difference
between that and the infrared, like what is there in terms of
big difference?
So what is the difference for your body or whatever?
Well, so there's actually several differences. One is those traditional saunas that you think the rock sauna, most of your gyms, things like that, those are going to be heating the ambient air around you. So the air around you is heated up, right? And then it's
is it blowing?
No, it's
I've
not
never
blowing.
been in one.
Oh, really?
I've only been in the infrared.
Okay. Huh.
I've never been in one. I know. I don't like to breathe hot air.
Yeah. The addition, I'll just say the addition of the water, it matters with like steam and humidity. And so there's certain things that people...
and that doesn't go well with my hair.
Right. But that ambient heat is, it's easier to get hotter, right? So like a traditional sauna, you can get in the 180 range.
Yeah.
Super hot. Infrared's going to be 140, 150, probably topping it out.
Yeah.
And infrared is light based, right? And it's passing wavelengths through, so it's a little bit like microwave. So it's actually going from the inside out. So it actually, whereas the traditional saunas are circulating around that air, this is actually heating you inside and working
through the light.
And so it's hot, but it's actually a direct heat inside your body, as opposed to this ambient air outside that's affecting you. So the problem in comparison is ultimately it comes back to how hot can they go. So infrared's not getting as hot, which is why most people would say infrared's probably inferior to a traditional sauna. Simply because it's a heat issue. It's a 30 to 40 degree level difference. Doesn't mean infrared's not good. It just means it's probably not as good as a traditional sauna.
So the infrared is just that it's a red light, right?
Yeah, well,
but it is not
there's
red
different
light
ones. There's
therapy.
far infrared. There's near infrared.
Which is the wavelength size, right?
Yes, wavelength size. A true infrared is invisible.
Oh,
right. So red light therapy is not infrared.
Right.
Red light therapy, you can see red light. So and people get confused because, like, especially nowadays, infrared saunas. Like we've got an infrared sauna that you don't see light in.
Yeah.
Because it's older. The new ones all have LED stuff in it.
Yeah.
So when you walk in, it's red.
It's like a disco in there.
So that and most people would think, oh, that's cool. This red light is the red light's just
you still
for
can't see
aesthetic purposes. It just makes you
exactly.
But it's the infrared light is not a visible light.
Okay.
Yeah.
Okay. Well, that clears that up because that's a question too that people are like, why do you have red light and infrared? Is it not the same that they're both red? It's in the name.
Very different wavelengths.
Okay.
Yeah.
All right. So as far as like, is there a certain age of someone that is more beneficial in terms of being in the sauna, or is there an age of like if you are 10 years old, don't you dare get to a sauna?
Yeah.
You see what I mean? Like where it could potentially be.
It's probably less
harmful.
age related and probably more medical condition related.
Okay, what's that?
So
look
like if I've got a pacemaker, or if I've got some kind of cardiovascular issue where it's like I can't really tolerate stress. I mean, I'll just give you an example. I was in the steam room this morning. I don't have any cardiovascular, but I was in there for quite a while, and I could kind of feel like I'm getting a little lightheaded. You know what I mean?
I do that if my bath is too hot sometimes. Yeah, or get into a hot tub, and you're like, I just got to pull this part out.
I got to get out for a second. So I just, so you got to be really careful. So you got to know, It's a sauna or a cold plunge is not for everybody because of those medical conditions. So it needs to be something you ask, hey, doc, you think this is okay? This is what I've got. Because there's going to be variable, issues. But if somebody's got some significant cardiovascular issues, especially arrhythmia issues, it probably is something you need to kind of just check before you do it.
Yeah, check with your
more
doctor.
so than age, if that makes sense. I mean, I don't know that I'm gonna have my 4-year-old in the sauna, but
right. I mean, maybe.
I don't know that it's a bad thing. They get in the hot tub.
If you're in Finland,
yeah, I mean, they're probably not doing tons of studies on 4-year-olds in the sauna.
Right.
But I will say the longer you do it, meaning not duration at a time, but consistently over time. Right, you get heat acclimated, so then you are pushing yourself. So somebody who's just like with the cold plunge, right? You get acclimated, and that is beneficial. So the longer duration that you're doing over years or months or whatever is going to be more and more beneficial because it's going to take hotter temperatures or colder temperatures to elicit those kind of responses, which is actually a beneficial thing.
What is the best timing, the optimal timing to be in the sauna? Like in the infrared? Well, we'll just say infrared for
I'd
now.
say 15 to 20 minutes is probably, because that's
Can you
what
be there too long?
Yeah, again, you're not going to see, it's a diminished return on investment. Most of the Finnish studies in particular that have shown, we're talking, gosh, there's a study that has shown when it comes to cardiovascular, like mortality rates related to cardiovascular events. So people dying from a heart attack or dying from a stroke or dying from 63% decrease by the use of a sauna 5 to 6 days a week.
Oh, wow.
Yeah, so over 60% decreased mortality rate cardiovascular wise for the use of a sauna 20 minutes at a time, 5 to 6, 7 days a week.
Is this infrared or is this traditional?
This is a traditional sauna.
Interesting.
And these are huge population. Now, I'll kind of explain this for the listeners. So you've got, when it comes to research, right, you've got things like a population study or an observation study. So they're just looking at data as patients are doing things, right, collecting surveys or whatever. There's a lot of different ways you can do it. Those studies that are observational, you really can't draw cause effect. So we can't say if you use a sauna for 5 days a week, this is the result, right? But you can say there's a high association of decreasing that risk, right? So you can associate or correlate with that, but you can't say there's a cause effect. But my point is there's that dose response. The more frequently used at 15 to 20 minutes is probably the ideal. And, there's a gym here in town. I'll just give you as far as I don't know what their sauna's set on. It burns your nostrils when you walk in. I'm not lying.
What do you mean burns your nostrils?
It's so hot in there that it literally, and I'm not saying that's bad. I'm just saying it is not for the faint of heart.
It's not because you're smelling something like...
No, well, it could be. It could be. You don't know. But I'm telling you, and I've gone to a lot of different saunas, a lot of different gyms, and I'm like, man, that one hits different.
Do you recommend or do you see any benefit in using the sauna either before you work out or after you work out?
I personally like it afterwards.
Why? That was direct. I'm sorry.
It was. Well, for me, it's because I use the sauna as a little bit of like a meditation. Like it's
just
like
chill you out.
Yeah. So I don't have my phone. I usually do it in the mornings after my workout. So it's like, all right, I've worked out. I'm feeling good. I'm hydrated. I've been drinking water through my workout. So I just, I don't really love to sweat for a lot of so to me, do I really want to go in the sauna? Because I'm pretty sweaty, most people are when they come out, and then go to a workout and be like, I don't like that personally. I don't want to be that guy. So for me, it's just I can go to the sauna, then I can shower, then it can be done.
So it's just a personal preference for you. Yeah. There's no real benefit one way or the other.
There's people that do both. There's a lot of people. You'll see a lot of people who wear clothes and sweatshirts and hoodies.
That's what I was going to ask. Is it any different than when athletes put on a ton of clothes and then go run for however long just to sweat? Is that
it'd be very
different?
similar, right? As far as what it's actually
running.
doing metabolically, very similar.
Okay.
So again, that it would be if you're using that gauge, right? And we said, okay, a sauna session. So the average sauna session would be like a moderate cardiovascular activity for 20, 30 minutes. Well, I can ramp up. I can run faster. I can go up hills. I can go longer. I can wear a garbage bag and make myself sweat more. So you can do all those things, right? You can go at a higher temperature. You could stay longer. You could wear clothes. You see what I'm saying? Like, you could exercise. I mean, there's people who do push-ups in the sauna. I mean, there's a lot of people who will take it to the next level, just like they would with their cardiovascular health when they're running or bicycling or whatever. I have
an ultraviolet, or not ultraviolet. I have an infrared blanket.
Yeah.
That Rob got me for Christmas. My husband got me for Christmas.
Is it warm?
Oh, it's awesome.
Yeah.
In the winter, it's fan-freaking-tastic. But you get in it, and you can either leave your arms out, like it has holes that you can bring your arms out, or you can leave your arms in, and you literally just leave your head out, and you just lay there for like 30 minutes. And it goes up in temperature, so it has, it'll escalate in temperature, however you want it to. But it also came with just what you just talked about, like this silver suit thing that you can put on, get inside.
Underneath it.
Like you put it on you, and then you get it. It looks like a sleeping bag.
Yeah.
And you just get in it and sweat yourself to death. So I was like, I'm going to have to graduate to getting in there. Because when I first started, I thought, am I just going to lay here and be so stinking sweaty that it's just gross?
You would if you wore that suit.
You would if you wore the suit. But honestly, as I was laying there, I was like, this is making me so relaxed and so like chilled out. It was awesome during the winter. I haven't done it in the summer.
Does it have any like PEMF, like with the magnetic field stuff to it, or no? Is it just the infrared?
No, it's just the infrared. Yeah. It's literally just the infrared. But it's pretty awesome. It lives under my bed so that I can just whoop it up there and do my thing.
That's crazy.
Yeah. Huh. So, but I don't think it gets as hot as like our infrared sauna does for sure. But it was my version of trying to be able to do that at home, because buying a sauna for home is going to be ridiculous. So this blanket.
Well, they've actually come around where they've got like portable stuff.
Yeah.
That, I mean, they've got them now that's like a pop-up.
Like a spray tan thing?
Kind of, yeah.
Huh.
And you just unzip it and plug it in. I mean, they've really come a long way to
try to help
make things doable.
Yeah. If I was Joe Blow off the street walking in and I said, hey, I've heard this word cold plunge, I've heard this word infrared sauna, give me if you had 3 minutes to give me the download on why it's beneficial for me, maybe something that we didn't cover through questions, what would that be for let's do cold plunge first.
Do them separate?
Yeah. Well, you can put them together if you want to.
No, I would. Well, the reason I say that is because I would go back and I would start and say, okay, the benefits of extreme temperatures, one side or the other, is incredibly beneficial for your overall mental health, cognitive health, risk of dementia being decreased, your
God, I need that part.
Visceral fat being decreased, your alertness, your concentration. So it is good for us to be uncomfortable and to be comfortable with being uncomfortable, right? I
think that's key.
We should be looking for opportunities in our day to not be comfortable. And sometimes, especially when it's a controlled stress, because so many of us deal with uncontrolled stress where it's like you have no control over it. It helps us to compartmentalize that. And so there's just so many benefits there. So being comfortable with being uncomfortable is really important to get over. And then I think it helps you to start creating very helpful, healthy daily habits, because you do have to be consistent, right? If you do it once a week, it's not, I mean, it's cool to say you did it, but you're probably not getting any benefits from it, and you're being uncomfortable that one day, and it's probably not worth it, right?
Yeah.
So getting into those daily habits, it's not something that I usually say if somebody's coming in off the street and asking me those questions. I'm going to ask a lot of questions to them, like,
sure.
How much do you work out? What's your nutrition look like? Because it can also be overwhelming, right? If you ask Joe Schmo off the street who came in after eating McDonald's, is that really the best 20-minute use of his 20 minutes? If he had to choose, hey, I can do the sauna for 20 minutes, or I could go get a workout for 20 minutes. Go get a workout.
Yeah.
Right. Exercise is still the number one thing to do for cardiovascular health. And then stop eating the cheeseburgers, right?
Yeah.
So
good for you.
You've got to prioritize those things to say it's not for everybody. There's just no way again, most people are not comfortable with being uncomfortable. So
sure.
that weeds the majority of the population out. But then most people also don't have all the other disciplines in line to where they can really start utilizing that as a priority.
Okay. Fair. Is sauna, are you same? Or is there, if Joe Blow off the street's got a different version for sauna?
No, I would say the same thing with sauna. I mean, I think either one. Sauna, I think, is always easier to introduce.
Yeah.
Because most people are easier to get hot as opposed to being cold. So the sauna is probably the step of the introduction that I would recommend. Where I would push people towards cold, again, it goes back to the being comfortable with being uncomfortable and mental health. I'm probably going to, if I deal with a patient where, man, they feel just really, really like they're struggling with anxiety, they're struggling with depression, they've got a lot of mood swings,
overwhelmed.
They feel overwhelmed. They're, their marriage is falling apart, their job is falling apart. They've got stress with their kids, whatever it is. And they've been in that season for a long period of time. I'm actually going to encourage them, hey, why don't we start trying to introduce something to help you learn how to control stress?
Wait. So you're telling me that if you have someone that you meet that is super stressed out, you're not telling them to take an anti-anxiety pill? Is that what you're telling me?
They're probably already on it by the time they got to me.
That's what I just heard.
That's not what I do.
You're like, let's try a holistic approach, which makes me love you.
Yeah. But I would encourage them to, because it's getting back to what is it about that stress, right? We just want to numb the pain. And I'm not saying that those are wrong. There's times where it's like, no, you probably needed that for that period of time, right? That grief happens or whatever. But it's learning to adapt to our bodies. It's learning to control our bodies. And again, in those moments where circumstances are beyond your control, oftentimes it's hard to figure that out. Yeah. And so when you expose yourself to 3 minutes of being uncomfortable and then you feel good for 2 hours, then it allows you
different way of thinking.
I was able to handle that 3 minutes of being uncomfortable really well.
Yeah.
Now, you know what I mean? And so it just starts to develop into this, ether of mentality of like, I got this. I can handle these things differently than I used to be able to.
So not just for muscle recovery purposes, but also mental health and overall body health.
Yes.
What these two items, we can boil that down and make it as simple as possible.
It's the name of this podcast is Optimized Health, right? It's about vitality. It's about people becoming the best version of themselves, feeling like they used to, right? When they were younger, healthier, more vibrant. And these are just tools that not everybody needs to do it, but these are tools that people that's just going to encourage them and strengthen them to live a more vital life.
I love that. And way to sum up the whole episode today.
I do what I can, Mandy.
Listen. I just live in awe of you daily.
Yeah, that's right.
I work with the Josh Porter.
We got some big things happening. Speaking of,
we do.
Just the podcast and those kind of things. So we've got new YouTube channel out.
Yeah. That's exciting.
It is exciting. We got 28, 29, 31. I don't even know. We got a ton of videos.
Yes, there's a ton.
We cranked out a ton. A lot of that's kind of patient education and just education 101 on hormone therapy, which is obviously something we're pretty passionate about. And
it's
then,
exciting.
We're launching a newsletter. We're launching, kind of a new protocol for our social media, some blog posting, really just with the intent and heart of like, hey, how do we get this information into people's hands?
So how would someone get that information? Where's that located?
Yeah, new website too. On the website is at optimizedhealthnow.com.
Yes.
And then we have social media. So you've got different platforms, TikTok, Instagram, Facebook, Optimized Health Chat, Optimized Health Now. Different platforms have different names, but if you just start typing in Optimized Health, it'll pop up.
You'll probably see your mug too, just like instantaneous.
With hair.
With and without.
Josh 2.0. But and then again, hopefully here in the next couple months, we'll start using those platforms to start offering some new newsletters and blog posts and just more education.
That is exciting.
Love it.
That is exciting.
All right, until next time.
Until next time, my friend.